This day, though, this drive home, we're going to spend 2 hours talking with people about the proposed medical hospital district here in Hidalgo County. Pros and cons, inviting your phone calls, trying to spread the facts out on the table, or the perceived facts. I guess perceived facts will do in some cases. Dr. Lawrence Gelman is with us. He had a program here on 710 KORE for many years. He is an anesthesiologist. Are you still practicing? You still keep your hand in?
Yes, I'm. Someone's got to support the government.
You mean like your taxes?
Yes.
You earn some revenue and then you have to pay tax on it.
Right.
So yours is the last face people see before they go under. No.
Usually.
With that said, you have to be nice to him because if he's your anesthesiologist.
No. I usually direct them to look at the pretty nurse.
Yeah.
On the side.
So you distract them.
Count back from 10. 10, 9.
I never do that. Never.
All right, so the vote tomorrow in Hidalgo County is for the establishment of, or the opposing the establishment of, a district formed to support a hospital district. A district to support a hospital district. Duh. You're going to be for it. You've been doing commercials.
I'm for
Why
it.
are you for it?
Because it's money for health care that will stay here, and the way we're looking at the government, the way they function, I'm really concerned about the access to health care, not just for the targeted indigents, which is what they're doing with this bill, or it's for all the rest of us, because the government is moving away from specialty care, and if we want to preserve that, we need to get the medical school here and have the specialty residents here so we can maintain a level of specialty care, which I think is going to decline throughout most of the United States in the very near future. It's already happening, by the way.
Why is it declining?
Because the government is shifting monies away from specialty care to primary care. It's as simple as that, sort of producing less and less specialists relative to non-specialists. And beyond that, the population that needs specialty care is growing in relation to the number of specialists as the population ages. And so there's even going to be a greater discrepancy between those needing specialty care and those available to provide specialty care. And because most physicians are now going under hospital contract, we're now, or a contract in some way. In fact, I think right now it's over 60%, big change in the way medical economics is. So we're competing nationally. So we have to be able to provide an environment which will draw and keep specialists. And one of the ways we're doing that is with the medical school. One of the things that this hospital district is going to provide for is the medical school and residency programs.
We're talking with Dr. Lawrence Gelman. He's an anesthesiologist and are you an officer at Doctors Hospital Renaissance?
I'm on the board.
One of the founders.
I'm one of the founders, yes.
Yes, Roxanne.
Dr. Gelman, I have a question. You just mentioned right now the UTRGV Medical School. What percentage, if you know, of the revenue that will be generated will be actually going towards the new medical school?
I'm not sure the percentage, because when you're dealing with the medical universities, state universities, it's like trying to deal with the government. So, but anyway, my understanding is at least $5 million a year will go up from that's raised.
Total. So how many do you think is going to be raised a year, and then how many is that?
20 million.
So 5 million out of the 20 are going towards. So the other.
Let me back off because I realized I didn't set the foundation right. The tax will be 8 cents per 100.
Yes.
The tax cap is 75 cents per 100, which has been a big point of discussion. The 8 cents per 100 is supposed to raise $20 million. $5 million will go to the UT health system to support the functioning of the medical school.
So the other 15 million is going to go to the indigent health care?
12 million. This is according to Ramiro Garza, the city manager in Edinburgh, but I haven't heard it controverted. Then 12 million will go to indigent health care, which will replace what the county is spending.
Which was inadequate. And remember that we draw down federal monies.
And that
50 cents for every dollar.
Okay, so the 12 million will draw another 6 million for a total pot of 18 million. Now that leaves 3 million unaccounted for. But
isn't the school already being funded by the UT system itself?
Yes, to a great extent.
Isn't
So
it-
that's one of the. But the fact of the matter is that it allows us to determine the direction that school goes, because I'm just telling you, when you're dealing with these youth with the University of Texas bureaucracy, it's like dealing with the Austin bureaucracy. We need to have a say in how the direction of healthcare in the Valley, and the only way you can have a say is if you have money in the game. So it's now the other thing is, let's go back to this indigent deal.
Yeah.
This indigent care thing. Now, those indigents are going to be taken care of one way or the other. Okay, one way or the other, and the doctor's going to have to take care of them. The hospital's going to have to take care of them, and if they're not going to get reimbursed for taking care of them, then you have a medical environment which is economically unsound and unattractive. Okay. It's unattractive to bringing physicians in the community. If you're going to be required to take care of people without any source of funding, then that's going to be a deterrent to bringing physicians in the community.
No,
So
come
we
down-
all
come down to a lot of
pay
free care.
for it. We all pay for it
Okay.
because if we don't get the doctors, if we don't have a urologist for whatever reason, it's not just the indigents that don't get urological care.
Yeah, it's everybody.
It's everybody. Okay, so we need to look at this thing as trying to keep an economically sound healthcare system. All right, so the expenditures are going to be there in one form or the other. If you want to have a system that's economically sound, where the hospitals are economically sound and the physicians are able to maintain an adequate economic level, they'll stay here instead of going to Austin or Chicago or Miami. You're going to have to. You can't segregate out one part from the other. You can't segregate out. Well, we'll just talk about indigents. We'll talk about Medicare. We'll talk about Medicaid. We'll talk about insurance. You can't. It's a global deal. It has to be all inclusive.
What is, you're talking about indigent healthcare? What is the difference between that and the welfare activity or program that we're already paying for?
What are you talking about?
Yeah. What are you
Like,
talking
isn't
about?
there? Because
There's Medicaid.
so I want to know. Yeah, how many? There's Medicaid. There's what? So different
Medicaid,
ones
Medicare
go
is
for
only two
different
programs I'm
things.
aware
Right, other than charities. I'm not quite sure.
Well, 'cause I'm saying different
You're
organizations.
saying why
go-
are people indigent and don't get Medicaid?
Yeah, like
is that what you're
what is
saying?
the difference? Like, how do you determine what an indigent person is?
Well, there are kind of rules because essentially an indigent is someone who can't get Medicaid,
Okay.
essentially. Why can't someone get Medicaid? Well, whatever the rules are. They can't get Medicaid because maybe they're not a citizen. Okay, maybe they own a car, or maybe they don't have whatever Medicaid.
They're not the most destitute.
Okay, Medicaid is not paid for children with cancer. How about that?
Really?
Yeah, isn't that something? They'll pay for nonsensical stuff, but not for children with cancer. So that's why you always have these fundraisers. It's a big problem. Medicaid will not pay for the working poor. No, the working
I
poor
was about to
that
ask
have
you that.
heart disease or have cancer. We see it all the time in the hospital. You have the government spending millions and billions of dollars in non-essential health care because of political influences. But they won't pay for chemotherapy for children with cancer. They won't pay for that. They won't. And let me tell you something. When you're a child with, it doesn't matter. Even if you have a job, if you have a good job, the costs are incredible. Okay, so I mean, so essentially the bottom line is an indigent is someone who lives here who cannot get Medicaid for some reason.
Medicaid's
So
for the
that
poorest of the
doesn't-
poor without assets, typically.
That doesn't
Typically,
apply.
but
Not always.
it's not really run. On the other hand, if you're an illegal from Mexico and you're pregnant, you can come over here and show your Social Security card or whatever from there, your voting registration, and you get first rate health. So it's not. And let me tell you, some of the people come over aren't really all that poor.
So this doesn't apply to uninsured working people.
Any indigent is someone
That
is
pay
simply
taxes.
someone not insured, someone who doesn't have. I mean,
Roxanne's
when it
trying to
come-
figure out what the population is, which is a good question, which really can't be answered straightforward.
Well, the thing is, okay,
Because
6% of the people taken care of in our hospital are and I guess that would be the other hospitals as well, are classified as indigent. 25% of the people going into the emergency room are indigents. So it's a heck of a lot. Okay, so
once they show up at the emergency room, is their follow-on care free? let's say a person shows up with intense back pain. They have kidney stones. They have no money. Does the urologist get paid? The hospital get paid for the procedures?
If it's something that requires immediate necessary care, you got to do it regardless of payment. Once you're involved with the patient, you're kind of stuck.
Yeah.
So the issue there is whether it's emergent care, urgent care, elective care. So oftentimes, though, what's elective today becomes urgent tomorrow.
We're talking with Dr. Lawrence Gelman. He is one of the founders of Doctors Hospital at Renaissance. He is also on the board there. That means he's a part owner. He is, as I said, an anesthesiologist. He is also for the passage of County Proposition Number 1 in Hidalgo County. This really is only an Hidalgo County question. There is another state constitutional amendment called Number 1 that has to do with roads. It has nothing to do with this. That's on every ballot in Texas. He is for the establishment of the medical system. He would urge you to vote yes. We've got some phone calls stacked up. We'll see if we can get to them. And we want to talk more with Dr. Gelman about how this thing would work. And in the next hour, we've got some people who think this is not a good idea. And we'll see why they think why they think they're right. You're listening to 710 KURV. You're listening to 710 KURV. I'm Davis Rankin along with Roxanne Garcia. We've got callers stacked up and would ask you to stay there because I wanted to see if we can get some more facts out on the table with Dr. Lawrence Gelman. He is one of the founders of Doctors Hospital at Renaissance. He is on the board there, an anesthesiologist. Now, let me ask you this. As long as I've known you and you've been on the radio, you have been adamant against the bureaucracy about the growth of... Did I take your question?
Yes, you did.
Go ahead.
Well, I was just going to say, you did have a show here, and a lot of your background is conservative, which is low taxes and little government. So why the sudden push now on Prop 1? That is a tax increase.
Well, the problem with government is that it's disconnected from the people. The reason the country's in a mess is because we're being run by a bunch of weirdos in Washington, D.C. Government is going to exist. Thomas Paine said all government is evil, okay? But you try to have the least evil government. And to me, the closer to home that the people who govern are, then that's what you ought to try to do. Even Austin is too far away. But right here, the people making the decisions as to where the money is going to be distributed, they live right here. You know where they live. You just walk down to City Hall, here or Mission or wherever else you're going to go, and you can grab their ear. So, if there was a vote to get rid of government, fine, get rid of government. But in the real world, we have government, and to me, anything that we can do that keeps local money local, and that the people making the decisions are local. That's one of the reasons our hospital functions so well, is because all the decisions are made locally.
Yeah.
Okay, so it's still a bureaucracy to a sense, but you want to keep it local. That's why.
Okay, is there any other way maybe that we can go about this without having to increase taxes, like take it from another fund or something like that? Is there any other way we could probably do this without that?
Well, there are, but I'm not sure how that goes into this discussion. The state spends a huge amount of money on Medicaid right now, upwards of $30 billion a year or something like that. Most of it is misappropriated. So there's plenty of money. Well, a good way of doing it was saying, you know what? No more Medicaid. We're just going to distribute some kind of voucher, and then you go buy your own health care in any way you want. That's going to save a lot of money, but takes away power from the government, so that'll never happen. So, yeah, there are other ways of doing it, but they're not going to do it. So we have to look at ways that we can do it, and this is one way that we can do it, where the important thing is that the decision for the expenditure is going to be done by people at the local level, not in Austin. And that's very, very important. And it's something that needs to be put in place, because we need to have a mechanism so that if Austin or Washington, D.C. comes down, keeps going off in these wrong directions, we need to have some kind of buffer between them and us. And the only way you can do that is if you're in control of the purse strings. I understand it's not a gigantic sum of money, but the fact of the matter is that the more you can control the purse strings for your health care, and more of that is done locally, the better off we all are.
Who is accountable as to where the money goes?
Well, my understanding is that different city councils are going to have representatives, or different cities. There's going to be a hospital district board.
I actually have that in front of me.
And so there's going to be representatives from the cities, and they're going to be the general directors. Okay. Now, one would hope that they would take, consult from the hospitals and the physicians, and I imagine they will, that they'll do that from the people who are actually delivering health care so that the distribution of monies is used most efficiently.
I've got the implementing legislation in front of me, and fall back on what you see on television, right? Subchapter B, District Administration. They're going to create a body of 9 people. 4 of them will be appointed by the Commissioners Court. Then McAllen will have 2 because it's got the largest population in the county. And then 3 other cities in declining population. The next largest 3 cities will have 1 each. So the cities will have the balance of power, if that's important to people, if that's the way you want to put it. They'll make all the decisions. We had one caller who's adamantly opposed to it, and they have a lot of power, the board does, whether it is whether they have the same power as like Houston.
Who appoints these people?
The city commission.
Okay.
City commission will appoint. So McAllen will appoint 2, City of Edinburgh will appoint 1, and I guess Mission and FAR will appoint them. Now, there is a proposal, not a proposal. One guy in Westico wants to throw Mission off and put Westico on because Mission's mayor, who'll be here the next hour, is opposed to it. But I don't know.
I imagine that's not in. There'll be variations over time.
My takeaway from this, there's no mention of hospitals getting paid. There's no mention of doctors getting paid. For indigent health care, will doctors how do they get paid out of this? Assuming hospital.
Yes, the doctors will apply to be in the program, as I imagine all doctors will, to do with Medicaid, and then they will submit to whatever body they create that does the distribution of funds. They will just submit their bills as the hospitals submit their bills, and it'll be looked at by people who know what they're looking at, and then make sure. And of course, it has to be. Remember, it has to be allocated. It's going to be for a year, so you can't say, "Well, here's $20 million today. Oh, we're out of money," which is what the county used to do a lot.
As long as
the
county has never appropriated enough money to handle all the indigent health care. They appropriate X amount.
Well, what they do is they just spend it as the bills came in, and then around the 9th month they'd say, "What? We're out of money? How did that happen? We're the government. Print some more." Only Washington can do that. Oh, okay.
All right, we're gonna pause for news at the bottom of the hour. We got callers stacked up. We'll get some callers. Dr. Gelman is here for the hour. If it goes that long, if it doesn't, I'm sure he has other tasks to attend to. In the next hour, Mission Mayor Norberto Beto Salinas wants to explain why he's not for it. And then, your calls and questions continue at 800-580-8255, 800-580-TALK. Davis Rankin, Lawrence Gelman, Roxanne Garcia on the drive home. You're listening to 710 KORV. I'm Davis Rankin along with Roxanne Garcia. This is the drive home on 710 KORV. In the next hour, we're going to talk with Mission Mayor Norberto Salinas. He has agreed to be here on the phone.
No, I think in person.
All right. Right now we have Dr. Lawrence Gelman, the anesthesiologist, founder of Doctors Hospital and Renaissance. He is in favor of the proposition number 1, county proposition number 1 on the Hidalgo County general ballot tomorrow, which would establish a hospital district in the Rio Grande Valley. We have some callers. Let's go to Omar, because he's been holding the longest. Omar, thank you very much for calling 710 KORV. What's your question?
Davis, thank you so much for having me on the air. Dr. Gelman, thank you so much as well there, ma'am, for letting me talk. Dr. Gelman, just wanted to ask, out of curiosity, would this bill in any way take away, if it was to fail on Monday or on Tuesday, would it actually affect the medical school in any way severely?
In the short term, probably not. We're looking at long term. The funding will come in one way or the other. It'll just reduce the power of the people of the Valley and the medical community of the Valley to determine the direction of the medical school, but the medical school is coming one way or the other.
Really? You think so?
Yeah.
You think they're committed, in other words, but Okay, never mind. I quit it. Drilling down. Omar, thank you very much for calling 710 KURV. We go next to Roman. Thank you for calling 710 KURV. What's up?
Hi. The medical school seems to be what the ads have been in favor of, and you just admitted that the medical school is coming. And I since I live in Brownsville, I've seen how UTB and TSC had the divorce, and the argument for having the partnership was so that we in Brownsville and the local community would have a voice. But after a while, it seemed that the voice of the local community wasn't there, and that's why they divorced. The voice was really in Austin regardless. I don't understand why anyone would argue that, oh, well, we'll have this $5 million, and somehow that, puny $5 million in the long scheme of things is going to somehow let us have some sort of direction in terms of medical school when UT system has already shown, at least in Brownsville on this end of the valley, it doesn't do that.
All right, let's see what Dr. Gelman has to say.
Well, I don't know what's going on in Brownsville. I just know here we have a lot of local commitment, and I can assure you that here in Hidalgo County, here in Edinburgh and McAllen, Mission, and the rest, that we have a lot of say as to how the school is going forward, and we have a lot of say as to what's going on in Austin as regards to school. Now, a lot of it is credibility, okay? And so if the community is shown to have credibility by passing the hospital district, that lends credence to things that we say. But if the community abandons us, if the community abandons if the local community abandons the medical community, which is essentially what they would be doing by turning down Proposition 1, then the medical community and the local community loses credibility in Austin. That's the way I look at it.
Thank you very much for calling. But, one of the things that surprised me is how little, maybe it's known, but they're just not saying it, or people like me are not asking the right person the right questions. But, like, how is it supposed to function? I've read the legislation, and I have a general idea how it's supposed to function. But drilling down who they think is going to be on it, or the qualifications of the people who will serve on the board, because that will be a very powerful job because of the amount of money involved. And it calls for setting up hospitals and like a mobile emergency service. And I'm thinking, we're not going to have a charity hospital, right? They're not going to build their own separate hospital for the medical school.
No,
they're going to use all the hospitals here.
Yes.
And so how will that function to your knowledge?
Or I'm not clear, for emergency medical services, or what do you mean?
Well, there is I didn't mark it. I just read it. They're going to have a district administrator who will run the district. I'm thinking, well, what's there to run? You guys are doing all the work.
Right. I imagine they're talking about where the distribution of funds, but sticking to that topic, I can assure you the medical community is going to have a strong voice in all this. You're not going to have a bunch of bureaucrats sitting in some office somewhere and then just willy-nilly passing out this money.
Well, who's to say they're not going to pick their political buds? I mean, the doctors are notorious for not being effective politically.
Well, I think when it comes down to personal economics, you'll see their effectiveness increase. I can assure you this: look, we're going to be more effective with the people here, with the political class here in Hidalgo County than we are going to have in Austin. Okay, the bottom line is everything is relative.
Yeah. Okay,
and so if the medical community here, I mean, these things go from year to year. And if there's improper or inappropriate response by the hospital district to the medical needs, that's not going to remain silent. Voices will be raised. People will not get reelected. Okay, those things will happen. I can assure you that we're not talking about, now you know very darn well there's a lot of prominent people involved with this entire project. I can assure you that those people are for the community, in the community, for the community, and for medical advance in this community. And I can assure you those people are not going to sit by quietly if that money is not used appropriately.
Let me ask you a question which just has to be in people's minds, fair or unfair. Right now, Hidalgo County spends $6 million, if my memory is right. $6 million they appropriate every year for indigent health care, and when it's gone, it's gone, it's gone before the year is out.
Right.
This will raise $12 million, it'll raise double that for indigent health care, and then another $6 will come from Washington, so you have a pile of 18. This is not couldn't this be characterized as just, and the hospitals are all behind it, right? The PAC that Bill Adams he's at NAP. The hospitals are paying $400 and some odd million to promote the passage. Isn't this just the hospitals trying to get money out of it?
I do believe, I understand what you're saying. You know what it's completely outrageous for people to get paid for services rendered. I understand that in your thinking. But it's not just the hospital's going to get paid, it's the doctors are going to get paid. And the thing is,
why should I add 8 cents per 100 to my house just so that NAP can get more money?
Doesn't insurance...
That's the way they're thinking about it.
Well, so that NAP can pay their nurses, okay, can buy the equipment, can buy new equipment, can pay a good rate for the nurses so the nurses don't go flying to use and things like that. I mean, it's okay. It's crass. I understand. But money is what makes the world go round. Okay? If the hospital has money, they can buy better equipment. They can pay better salaries. They can expand their facilities. Okay? And I do understand your chagrin that doctors would get paid for the work that they do. But the fact of the matter is
that's not right. But
that's what we're talking about. We're talking about. Now, let me ask you this. Now, we're all human beings, right? Okay? Let's look at Kobe Bryant. Okay? All right. He's a great basketball player, and you don't pay him any money. What happens?
He doesn't play.
He's still a great talent, but
because the government can't.
You want the doctors. You want the doctors. You want the doctors to work. I mean, they're human beings. Okay, they need to be remunerated for their efforts. It takes a lot of energy to be a physician.
I have a question. Davis, you just mentioned something about 8 cents, correct? That's the initial tax rate. Well, I have here the legislation, and it says the creation of the Dow County Hospital District, providing for the imposition of the ad tax at a rate of not to exceed 75 cents of each 100 valuation. Where did the 8 cents come from? Because I went through this whole thing, and I did not see 8 cents initially at all. So my question to you is, do you know where the initial 8 cents came from? Because here it clearly says...
Commissioner's Court, I think.
It says not to exceed 75 cents. This is the law that I have in my hand right now.
Not to exceed, but my understanding is
but where did the 8 come from?
I think that's what they've agreed upon. It's going to be 8
Court. But who? I'm saying who agreed on that? The Commissioner's Court?
You ask an excellent question, Roxanne, that I cannot answer.
Okay.
But I believe it to be just what the Commissioner's Court came up with. But how they reached that figure, I don't know.
Okay. Well, I was hoping for an answer. If somebody knows the answer.
Well, in the next time, Beto may know.
I'll ask him.
Oh, let's see. Who do we go to next? Maria, thank you for calling 710 KORV. What's your question?
Yes, thank you very much. Thank you very much.
You're on the radio.
Yes, thank you very much. I want to ask Dr. Gelman if they are not expecting a lawsuit against the misleading advertising they have, because they are advertising on their ads, on TV ads, on the signs. They are advertising basically the medical school. And the medical school will only get 3% of all the income out of these taxes. Basically, the hospitals are getting them. I will be getting 97% of the money.
Doctors too, and other healthcare related expenses.
Where the people that are inside, and that's what I mean. They will be lining their pockets because they have captive customers.
I just asked that question.
I have a business, and I wish I could have captive customers.
All right, we still love you, Maria, but I just asked the question.
Where'd you get that 3%?
I don't know.
I thought it was 20% was going to go to or at least 20% to the medical schools. $5 million.
So $5 million out of 20.
Well, poor Ramiro Garza's. I'm sourcing this. He said here on the program, of the $20 million a year raised, $5 million go to indigent health care. No, $6 million go to indigent health care. 12. No, I'm impugning myself. 5 to indigent health care. 12.
Whatever.
For the medical school, 12 for indigent health care.
At least 25%.
And $3 million.
At least 25% will go directly to the medical school, and the rest of it will be indirectly into the system that provides for the medical school.
So what happens if the Valley says, we're not going to do it, UT, you're on the hook, you got to come? I don't know what happens because I don't think that's...
The school's coming regardless, but I have a question that I really want to ask. Okay.
We have Dave as the last caller.
Okay.
I didn't know we had captive customers. I better go check that out.
If you get sick, you go to the hospital. The hospital's got you. You can't just...
Oh, I see. Because the hospital Gestapo goes to your house and drags you into the hospital, right? Help! Free me! I don't want to be here.
I have a question. If there
Well,
is
ask it.
okay,
so
well,
you've
I'm
never
trying,
been
but you
sick-
guys keep on
you've
talking
never
and
been sick
interrupting me.
before.
Let me ask the question.
I have been sick, and therefore I appreciate health care. I've never considered a hospital as capturing me. I think, if there's one service in this community that provides for the people of this community, it's the healthcare system. Okay? I mean,
Okay.
geez.
My question, finally.
All right,
Thank
go
you, gentlemen. If there is no plan, like I've heard a lot of people that are for Proposition 1 to go to 75 cents, why on earth is that the cap?
We conformed ourselves to the state constitution. That's all I know.
Okay. So,
Because I look at it like this. If I'm applying for a credit card and I ask the credit card people, I want $10,000 on my limit, but I'm not going to use all $10,000. I'm going to use $1,000.
Yeah.
Why on earth am I going to ask for $10,000? Because I think the credit card company might think, well, she might use it later on if she's asking for $10,000. So why on earth is there a cap of 75 cents if people that are for it are saying, that it will not get to 75 cents? So why is that there in the first place? That's my question.
Why are you so suspicious?
It's a great question.
It is a good question.
Thank you.
I don't know. It seems to me they've been wiser to have capped it at 25, but they didn't have
Probably.
To.
So-
And that doesn't at all kind of concern you, Dr. Gelman?
well, if that's the government always concerns me. But the thing is that if that's the question, and if it's not just if that's the only question, then of course then that's how it ought to be addressed. We address why do you do that. I mean, if we're talking about do we need a hospital district, yes or no, that's one question. I think a taxing district, I think we do. If you're talking about the limits on it, well, that's another question. And there are, clearly I would have some reservations along those lines as well. You obviously, there's a question why for that. I would think that would never happen because everything has political consequences. Okay, you do something like that, you have a political consequence, you're voted out of office. Okay?
But don't you think that if it does pass and the law and somebody does want to increase the tax to 75 cents, but then didn't we have somebody on the show say that, no, it's going to 25 cents, we're going to take it to the legislator. But I was told, but if it's there, don't you think they'll say, oh, well, they voted in favor for it if it passed. So that must mean they knew the cap was 75 cents.
I think
And
people
that
are
must mean that
voting
we must,
for
yeah.
a hospital district and not that particular thing. I would just say that I would say that would not be implemented. I think it's a legitimate concern that probably needs to be addressed probably a little better than I'm doing it. But I think there are political consequences to everything that is done. I think anyone that would do that or approach that would probably get voted out of office.
Mm-hmm.
Furthermore, if they did that, there's nothing to prevent that from being taken down to 8% or being eliminated entirely. So
if
for
they
me,
raise tax above, because as far as we know, it's subject to the Texas rollback tax provisions, and they would be subject to a rollback election, which is a very difficult thing to do. But it's not like they can just raise taxes with whatever they want.
Okay.
By the way, as we go to break, Dave, you're next. The politicians have said they will ask the legislature to lower the cap to 25 cents 100. I believe they're going to do it. I believe they're sincere in doing that for a variety of
But will
reasons.
they?
But that doesn't mean that it will happen. Typically, that stuff does happen because of the nature of the legislation, but that doesn't mean it's certain. You're listening to 710 KORV. You're listening to 710 KORV. We're talking about Hidalgo County Proposition Number 1 that would establish the medical district if it passes. We've got a proponent in the studio, Dr. Lawrence Gelman, who has advanced his reasons why it ought to be passed. And those of you who listened to Dr. Gelman's show know he's real skeptical of government, but he says better to have it down here than way the devil up there. That's one of the reasons he says he's for it. In the next hour, we have opponent Roberto Salinas of Mission. Dave, you're our last caller of the hour. What's up?
Hey, good afternoon, Dr. Gelman. Thanks for being on the program. Roxanne and Davis, thanks for taking my call.
Thank you, Dave.
A couple of comments. One, you made reference, Doctor, a couple of times to control up in Austin, and I don't know what control you're referring to. If that's the medical school, which is a different subject altogether. Whoever the proponents are, were probably ill-advised in trying to combine the two. Davis and others and Roxanne and Doctor, I don't know if you have a copy of the legislation, but folks ought to know that while there is language which allows for funding of the medical school, there's nothing in the legislation that calls for it, requires it, or compels it.
No.
And I think that distinction needs to be made, and then folks can stand up and line up and decide whether they want to argue for or against the med school as a separate subject matter. And I'll get to a question, and I know that I was supposed to call in with one. And just one other comment. I mean, I could go on and on. My chest is busting because this thing just makes me so riled up. Had the proponents, gone throughout the various communities within the county and explained the thing and allowed people to come back and answer questions, I don't think any of us would be having the conversation now. For example, and the doctor may or may not know, the power of eminent domain is in there for one. Many people don't even know that general obligation bonds are allowed to be issued by the board.
By a vote of the public, as I think.
No,
right?
no.
By a vote of the board?
The board, the hospital board, and that's another thing, Davis. When you read that, people need to keep in mind, they don't vote for the board, the hospital district board officers. They're appointed by 5 different governmental entities.
Yeah.
So if you want to change the hospital board, you're going to have to sweep your own municipality and then get them in unison to replace the 1, 2, or 3 board members they have.
It's like the appraisal district.
No, yeah, he's actually right. I have it right here. It says, in exercising the power of eminent domain, if the board requires relocating, raising, lowering, rerouting, blah, 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 blah.
And later on, in a couple more pages back, it talks about the general obligation bond. So whatever they come up with, 8 cents, 25 cents, which, as Roxanne pointed out, is not in the enabling legislation. Let's just pick a number and say it's 10. If they start at 8, the next year they can issue a general obligation bond and pay for it with another 2 cents if that's what the cap is. There's no limit to this thing, Doctor. You're hanging, not you personally. Proponents are hanging the taxpayer out on a hook and giving them a blank check.
All right, Dave, we got to let Dr. Gelman reply because we're almost out of time.
Well, once again, it's a question of human beings.
Listen to your show.
Okay? And so either you're going to trust the community leaders to do the right thing or you're not. I mean, the fact of the matter is, you can't trust the people in Austin. You can't trust the people in Washington, D.C. I get that because there's no way we can get to them. So to me, look, if you can't trust your leadership, it really doesn't matter what the legislation says, okay? And if you do trust your leadership, it really doesn't matter what the legislation says. And so that's it. So, I mean, that's kind of just so if you think that a piece of paper and how it's written in a piece of paper is going to dictate, if that were the case, the country wouldn't be in the state it's in now. Even the Constitution is not adhered to.
Let me make sure make one thing clear before we go. We're almost out of time.
I have one question, though.
This, the money that people would participate in the program, so doctors do have a chance to get paid for their indigent care that they're rendering for free now, as do hospitals, right?
Yes, of course.
Well, okay. Do you feel that Prop 1 is something that needs to pass in order for Hidalgo County to be better? And then 2, what is a perpetuity of hospital district? Like, how long is it going to be forever? Are we going to have it forever?
So Jesus comes back.
I don't know what forever means, but
I'm trying to make it quick because we have like 10 seconds left.
Yeah, we need it because we need the money in order to provide the health care that the citizens require. That's all there is to it.
Dr. Gelman, thank you very much. We'll see you in the next hour.